mental health framework, recommendations for colleges and universities to support the emotional well-being and mental health of students of color. It's a pleasure to be here, and I'm happy to see all of you this morning. My name is Sara Abelson. I'm a PhD candidate in public health at the University of Michigan, and I'm the co-investigator and lead for diversity, equity, and inclusion projects with the Healthy Minds Network. My pronouns are she, her, and hers. I've been working in the field of mental health for over a decade and had the honor of working with the Steve Fund before returning to my time in graduate school at Michigan, and it's just such a joy and pleasure to have the Steve Fund here today, combining and sort of supporting the really, really great work that's happening in Michigan. So again, just thrilled to have you all here, and I think we're in for an exciting morning and an exciting day. Today we're lucky to have Dr. Stephanie Pinder-Amaker with us, actually welcoming her back to Michigan. She is an assistant professor of psychology at Harvard Medical School and director of the College Mental Health Program at McLean Hospital. Dr. Pinder-Amaker has over 25 years of experience in college student mental health treatment, administration, and policy. She is a member of the World Health Organization World Mental Health International College Student Initiative and has published on the prevalence and distribution of mental health disorders among college students and the integration of student concerns into traditional models of care. She's the founding director of McLean Hospital's College Mental Health Program, a unique initiative serving students from over 200 institutions of higher education and providing student-focused treatment, consultation to institutions of higher education, and related research. Prior to McLean, Dr. Pinder-Amaker served as the Associate Dean of Students at the University of Michigan, where her portfolio included critical incident management, counseling and psychological services, and sexual assault prevention and awareness, and also student services and student services for students with disabilities. She co-founded the Twin Star Intersectional Diversity Trainers in 2018 to address issues of identity and inclusion in the workplace. And I will be handing it over. She'll be presenting, and we'll be sure to leave some time for some Q&A at the end of the session. As mentioned previously, you are encouraged to join us and contribute to this conversation and continue it online by following the Steve Fund, the National Center for Institutional Diversity, and at UMich students. So we hope to see you there as well. Thank you.
Oh, thank you, Sarah. Welcome, everyone. That was such a nice opening this morning, a really nice foundation for the work that we're going to be talking about in our time together. My understanding, and did you already mention this, Sarah, that we just pushed back everything, so we will go until 11:20. So I'm here to talk to you about sort of the background story to the Equity and Mental Health Framework. I'm going to tell you a little bit about its inception, the process that the Steve Fund and the JED Foundation with some other partners from around the country engaged in to develop the framework and now advance the framework. We're going to go through the 10 recommendations together, time permitting, and then I'll talk with you about the current status of the work, because it was mentioned, and so much of what I was going to say was actually mentioned this morning. So I'll try to edit accordingly so you're not hearing things, over again. How many people, first of all, I'm going to get a sense, how many people are already familiar with the Equity and Mental Health Framework? Just a show of hands. And it's fine, it's just us. So, know it. Okay. Anybody here from a school that has actually, tried to take hold of the framework and decided we're going to begin moving into some of these recommendations? We're going to begin a process to figure out, for our particular institution or department or program, we're going to try to work our way through some of these recommendations. Anybody here with any? Oh, somebody in the back. Okay. Do you mind? Not to put you. Are you the only one then? So I am going to put you on the spot. What institution?
Western Michigan University.
Oh, great. So you're one of the pilot schools, actually. Oh, great. That was very easy. That was my next question. Is there anyone here that's actually participating among the 19 colleges and universities? And it looks like we have one. Great. So feel free to jump in, chime in. The original format for this, we had hope to have one of the representatives here with me from a pilot school who could sort of talk about some of the challenges and experiences, successes that they were actually having as they go through the pilot process. It's a 3-stage process. But unfortunately, they weren't able to join, so they're just stuck with me. All right, so why are we here? The Equity and Mental Health Framework was born out of the recognition on the part of the Steve Fund and the JED Foundation that there simply weren't sufficient evidence-based guidelines available that schools could follow when supporting and promoting the mental health and emotional well-being of students of color. Period. That was like the beginning point. And so Steve and I'm just going to not call the foundations and everything, I'm just going to shorthand it and say Steve and Jed going forward. You'll know that I mean the Steve Fund and the Jed Foundation. Collectively, then, they embarked upon this highly collaborative, iterative process. They went about gathering data, revisiting, both gathering survey data directly with students, but also revisiting existing data and then disaggregating that data by race and ethnicity. So they gathered and evaluated and reevaluated some significant quantitative data, but there was also a qualitative assessment that was an important part of this iterative process to develop the framework and the recommendations that we're going to talk through today. So one of the first steps that they took was they commissioned me and my program, the McLean program at Harvard, the College Mental Health Program, and asked us to do an initial piece of the legwork, which of course we were really excited to get the opportunity to partner in this way. And we started, as you can probably imagine how many researchers are in the room, with the literature review. And it was an exhaustive, extensive literature review looking for evidence-based mental health programming that colleges and universities were putting into practice, testing for their effectiveness, documenting, writing up, and getting back into the literature. So we started with this broad, comprehensive literature review. That did not yield exactly what we were hoping for, and so then we agreed to conduct a national survey. We surveyed hundreds and hundreds of colleges and universities around the United States to try to get at this information. We know that some really impressive programming is happening there. We know that schools are taking different steps and being really innovative in this space. But that hadn't quite made it, and it wasn't being reflected into the literature in a way that we could easily pick up on it. So we went out and surveyed those schools, and from the findings, from this long process, we actually conducted, I should mention, shout out to University of Michigan, we piloted the survey with a handful of diverse colleges and universities. We reached out, as I frequently do, to the leadership at University of Michigan, and Boyce Harper agreed to absolutely that University of Michigan would agree to be among one of the 6 pilot schools. So that was really helpful to us because it helped us refine our methodology and sharpen our tool and so forth and work out some of the bugs in the system before we went nationally. So from those findings, we then were asked by Steve and Jed to make a set of recommendations, to just take what we learned from the literature from these surveys and make a set of recommendations as to how we might begin to move this work forward. And then to propose, like in a perfect world, what might a framework look like, a national framework supporting and advancing this work. We did that. Now you're going to see me do this thing going with my glasses on and off because they're reading glasses, which means I can read with them on, but I cannot see you with them on. All right, so then we collaborated with wonderful partners, then the scientific advisor to the Steve Fund, Dr. Alfie Breland-Nobles, we just call her Dr. Alfie, Dr. Victor Schwartz, Chief Medical Officer of the JED Foundation. Alfie how they then took our initial recommendations and literally just hit the ground running with it. And they took that word back out to the national community. They convened thought leaders, they convened scientific experts in this area to then revisit the data-driven recommendations and to shape them, revise them, refine them. They convened 130 leaders, presidents, vice presidents, deans from around the country to also come together and take a look at the recommendations. Do they fit? Do they ring true? What changes? Do they resonate with you? And so forth. So this sort of collaborative process ongoing that probably will never end based on the things that we were talking about earlier today, that this work in a sense probably will never end, but it's this continuing effort to gather both qualitative and quantitative data and in an iterative process have them inform each other to move the work forward. And then about 1 year into the process, this was literally while we were still doing our initial work surveying. When I walk away from the mic, can you still hear me?
Yes.
Okay. We were about 1 year into the process of beginning this work. From an historical perspective, something very interesting, a watershed moment occurred in this country nationally. This would have been the 2015, a watershed moment occurred nationally on our college campuses, 2015 to 2016. Does anyone know what it was? Black Lives Matter was an impetus for then what played out all over, just started igniting like wildfire, campuses all over the country. And that's right, from a historical perspective, Black Lives Matter was an important part of that. But students of color took to the campuses all around the country, and they were protesting, spurred on by some of the incidents triggered by the Black Lives Matter movement. And they were going to their college campuses. I can only imagine what things were like here in Ann Arbor or in East Lansing or Western Michigan or Eastern Michigan, but I can tell you where I was in Boston and Cambridge area, we're surrounded by 75 colleges and universities within about an 80-mile radius of the city. And students were on campuses making their voices heard, issuing their demands, and for the first time in our nation's history, and this still just overwhelms me, on that list of demands, students of color had mental health. We want our mental health needs addressed effectively and appropriately on this campus. So a pivotal, important part in this story, that students really helped to spur things along and definitely elevated the sense of urgency around this work. We couldn't work quickly enough, but we were in process. I mentioned that the data continued to be gathered and collected, and I mentioned that one of the things that the C funded in collaboration with Jen was that they revisited the first year experience study and then disaggregated that data. Is anybody familiar with the first year experience study? I see some heads nodding. Won't go into the details here, but the big takeaway, the big headline when they published the results of this study in 2015 was that this was a survey of 1,500 first-year college students around the country. And, just a really interesting survey. They reached out to first-year students and surveyed them about the transition and what their first-year experience was like. They wanted to hear from students about what successes did you have, what was working well, what barriers did you encounter, where were the high points and the low points and so forth. And what they found, a lot of interesting things came out of the study, but this was, again, the big headline. The students who entered the college campus feeling emotionally prepared for college were more likely to rate their first year experience positively and to do better academically. Often it's presented in the reverse, that students who arrive on campus feeling less emotionally prepared were more likely to rate their college experience, less emotionally prepared than their peers, were more likely to rate their college experience as terrible or poor and have lower GPAs. So this was significant, and this was an example of a data set that Steve and Jed went back and revisited, disaggregating the data by race and ethnicity, as we saw done earlier here today, and found that those findings were even more concerning for students of color. It begs the question then, what is emotional preparedness? And I'm just pausing for a moment to put this particular construct out there. We're not going to have time to go on into it, but you can look at it later. I love the construct because EP, emotional preparedness, speaks to a student's ability to do 4 things. To 1, take care of themselves, 4 pretty basic things, take care of themselves, build healthy relationships, control negative feelings and behaviors, and adapt to new environments. And if you think about what we just said, the words that we're using, emotional preparedness, ability to take care of oneself, what you don't hear is a lot of psychological jargon. You didn't hear any diagnostic terms, although certainly when we're talking about the realm of being able to manage and control negative feelings and behaviors, we're definitely moving into psychological territory. But the EP model doesn't use it. It's very approachable, and we have continued to work with this model and adapted it our work with colleges and universities and secondary students. We find it really effective for opening up dialogue around these important issues rather than shutting things down. So that was just a bit of a... Okay, so all of those ingredients, the data, the qualitative data, the quantitative data, all of those ingredients went in together into the formation of what was eventually launched in 2018, I think was when it was officially launched, the Equity and Mental Health Framework that was mentioned earlier this morning. And what you have here, and I was so pleased to see that it's actually in your books already, so you can refer later to the back 2 pages of your book, the framework itself, the background, the statement of need, the goal, the recommendations are all spelled out here. And everything, not everything that we're talking about, but you should also know that there's a wealth of additional information about the Equity and Mental Health Framework at the Steve Fund website. You can go there and see so much more about all of the services and supporting opportunities. But the framework is there. And what the framework is now is basically a very practical set of 10 evidence-based recommendations and guidelines that college administrators, faculty, staff, student leaders, the entire campus community can follow in an effort to support and promote the mental health and well-being of students of color much more effectively. 10 basic practical guidelines, and we're going to talk a little bit more about those guidelines and where that work is as we speak. There are also a subset of strategic implementation strategies. So it's a little bit beyond just a recommendation to do this, but here's how you might take those first steps. So some strategic support, and now if you go to the website, you'll see that a toolkit has emerged in further support of the guidelines. And this toolkit, I envision, will be a living document. It's going to continue to expand and grow as our research and our investigation and the piloting of this work now with these 19 colleges and universities, the data from that will come back. It'll be fed back into these recommendations and the strategic implementation steps. And also you're going to see additional resources that you can tap into and access from where you sit in your role in your particular campus or university. So as we approach the guidelines, I want to encourage you to ask yourself a set of questions. You might think to yourself, is this particular recommendation or step something that we've already done on our campus? If the answer is no, that's okay. That's why the guidelines and the strategic implementation steps are here as a starting place. If the answer is yes to any of these guidelines, then I would encourage you then to think about, and how is this working for us? Is this effective for us on our campus? If the answer is yes, how do you know? How do you know that your implementation of this particular recommendation or guidelines is really aligned with the positive outcomes that we want to see? How are you measuring the success of the implementation of this particular guideline, recommendation, or strategy? And then another question to think about as we walk through the guidelines is, where is that information held? Who's the holder of that knowledge? So you implemented a guideline maybe as dean of an entire one of the 19 schools and colleges, for example, at the University of Michigan. And you feel like you really maybe encountered some bumps and bruises along the way, some barriers, but you figured out strategically how to get through, push forward, and advance this work. So you really learned some things, some takeaway lessons. Ask yourself, who knows about it? With whom have you shared that? Do the other 18 schools and colleges at the University of Michigan have the benefit of that experience and knowledge that you have acquired in advancing this work? And we want to think about this systemically within and across your college or university setting, but then more broadly throughout the Big Ten or the Midwest, and ultimately nationally. We want to be thinking, and you're going to hear that reflected through all of the 10 recommendations that we're going to talk about. So just kind of have those questions in the back of your mind as we consider the guidelines together. Okay, recommendation number 1. To identify and promote the mental health and well-being of students of color as a campus-wide priority. We encourage institutions of higher ed to center student well-being and student of color well-being within the mission of the institution. Here, what we're really talking about, first and foremost, is a full-throated endorsement by the highest leadership on your campus. Your college or university president, the VPs, your deans, all of these people should be fluent and vocal and clear in their articulation of the fact that this campus has set the promotion of mental health and well-being of our students of color as the top priority. Everyone should know how to say that and how to communicate that message in different places and spaces among different actors. And there are, again, sub-strategies, some of the sub-strategies for implementation, and it's mentioned one of them briefly here, that it's important where possible to have this commitment embedded directly into your institution's mission. Be clear about it, be transparent, put it out there. Here's, I inserted this example. There are some excellent exemplars to refer you to, and I put this here because I'm hopeful that you can actually just Google Harvard Medical School Diversity Statement and you'll come up with this link. But if you get these slides, you can just click on the link. It's one example of a revised launching of a new statement of diversity that was implemented. What would you guess the year was? I don't know if it's not in the link, so you have to guess. When do you think this happened? It's 2019. Let me make sure I'm in first. Okay. 2010, 2016. We've got 2010, 2016. Yeah, just a little over a year ago. But I put the link here because I had an opportunity to witness the rollout of this very powerful diversity statement. And I would encourage you, after you leave here and go back to your respective places in the country, to maybe click on that link And you can even do this. I brought it back to my hospital because we're a Harvard affiliate and said to our hospital leadership, you know, we're a Harvard affiliate. Are we living this mission? Even to our leadership among our own McLean Hospital Committee of Diversity and Inclusion, which includes all the senior leaders of the hospital system. Like, is this a mission statement that we can truly say we're adhering to or even aspiring to achieve at this point? So there's a lot that you can do with this, but what I started to say is I would go to this link because the statement is there, but what's also there is a video of the initial rollout. And they invited everyone from around the community to come and be a part of it. And I would encourage you then, as you watch that video, it's only 44 minutes, I think, to think through the recommendation steps and for yourself observe or maybe pull together a team to see how effectively do you think they implemented or took these steps and recommendations of the equity and mental health framework into consideration. It's a good way of implementing and developing the framework and then communicating that framework to the university. Where is it housed now and so forth. It would be an interesting exercise. But they did I thought, a really nice job. Maybe we'll get to talk about it at a future date. As we continue to go through these recommendations, it strikes me, I return to these all the time, but there are 3 recurring themes, and I'm going to just ask you to be listening for them. They are to elevate, to communicate, and to evaluate. Those are 3 themes you're going to hear again and again embedded in these guidelines and recommendations. And so we just saw in the recommendation 1, right, the full-throated endorsement of the senior leadership that this is an issue we're invested in, we care about this, we're elevating this, we're putting this top of our priority list, front and center. So that's a bit of the elevation theme. Also, how that gets communicated, right? It's not just enough to create a marvelous mission statement that now embeds the value of the mental health, diversity, inclusion, and equity, but how is that being communicated and then lived into and operationalized throughout your university system? So, think about, you'll hear that. Elevate, communicate, and evaluate. Recommendation number 2. We're only at recommendation number 2. We're going to get there. Engage students to provide guidance and feedback on matters of student mental health and emotional well-being. And what we're really talking about here is continuing this process of seeking to learn. You know, it's like continuing a needs assessment. You have to keep your finger on the pulse of what's happening. And it never ends because what's happening in the lives of students changes over time. So you want to gather survey data with your students and you want to do that in a systematic, reliable way and accurate way so that you can have a benchmark against which you can measure the advancements that you're taking, the steps that you're taking. One example, just a quick model of where this happened very recently. It was illustrated beautifully earlier today. It's also the part about we want to gather the data, but also we want to make sure that we're really looking at that data specific to race and ethnicity when appropriate, meaning that we have all of the scientific factors in place to make that information meaningful to us. So recently, you're probably familiar with the American College Health Association. There are so many opportunities to survey our students. We've got the Healthy Minds survey that many campuses around the country are engaging in. The American College Health Association is another survey. More broad services that we work so hard to put in place to support our students to address mental health concerns. They're not even being diagnosed. So how and where are these students being supported? So that's an example of data that you're going to be, you'll see other versions of this. But it's a good opportunity to then go back and engage students directly with these findings to find out what it means, what's happening. Recommendation number 3. Actively recruit, train, and retain a diverse and culturally competent faculty and professional staff. Schools are encouraged to examine whether the identities represented among the student body are also represented in the faculty and professional staff. Here, what we know is that representation is a very significant issue for our students. And it means a lot to students. Every student wants to come into the classroom and see themselves reflected in the faculty, in their administrators, in their clinicians, in their service providers, in the PIs, in their labs, and so forth. So this increased representation is an important piece, but it's only one part of the equation. The other part that has to happen in a deliberate, intentional, and actionable way is that we have to also elevate the cultural humility, what some people refer to as cultural competence, of all of the staff around the university, right? It's not enough just to appear diverse or to have representation. Everyone has to really be skilled in some basic principles about cultural humility theory. And I would suggest to you that to really aspire beyond mere cultural competence, if you're familiar with the work of Dr. Melanie Trevelyan and Jan Murray Garcia, they are two women of color who 2 decades ago founded the theory of cultural humility. They're physicians down on the West Coast. And cultural humility, you can have the unbelievable experience of walking into one of the trainings. It was a train the trainer. It was a 2-day thing. I never get to do anything, be anywhere for 2 days. So my hospital made it possible to go to this training. I walked in, it was just last week, and so a train the trainer in cultural humility, and the actual trainer, the facilitator for the day was Dr. Melanie Trevelyan, and she is a force. She also announced that that's going to be her last training. They are coming out with a book that is going to capture the wealth of work that has been done in helping systems and institutions embrace the theory of cultural humility. And in short, it's just kind of thinking about the difference between, cultural competence as a set of checkpoints that, yes, I've got that, I think I know that, to switching a stance to being open and curious, to a lifelong commitment to learning, and also to assuming that the person that you're in relationship with, if it's a student, if it's a patient, it's an employee, that person is indeed the expert on their culture. That as providers, as caregivers, as health professionals, we don't make the assumptions that as if we think we know, but we remain open and curious. And there are several stages to the model, but there's also a wealth of information and materials available to you if you want to think about, which now I have the job of doing, thinking about how do I bring this back to my particular institution and integrate this training among the leadership and staff at Home College. Okay. Recommendation number 4, create opportunities to engage around national and international issues. It's very important, as I think everyone in this room knows, to both acknowledge the impact of events that are happening often on our campuses, but also in the surrounding community, nationally and internationally. And there's a framework that in our work that we use just to illustrate when we go to campuses and work with staff and faculty and professionals and try to teach them, it's a skill set to learn how to do this. I think about it, an analogy that I use sometimes is, how your computer has the Norton antivirus scanning system, or maybe it's the GAP, whichever one you use, but I bet your computer has one, right? And periodically you get that little message back from the system that says, scanning for viruses, I think this practice, developing this skill set, needs to be like that our campus administrators and leadership, providers, faculty, staff, clinicians, researchers need to be really skilled in knowing how to, what I refer to as scan the ecosystem for events that are happening that are impacting the mental health and the emotional well-being of our students. And in this case, in particularly impacting the sense of belonging and well-being of our students of color. And here's an example of a framework that we use when we go to campuses, we meaning the college mental health program, and we consult with schools. I want to say, just pause to mention one thing. I talked about what happened with college campuses in 2015, 2016, how students took to the streets. Since that time, the number one consulting question that we have from colleges and universities is around this issue, saying, help us figure out how to do a better job. We're not getting it right. We want to support and promote the mental health of students of color more effectively, and also of increasingly diverse student bodies, and there's just a miss. Can you help us figure it out? So just offer this to you as one theoretical framework that we use when we go to campuses and meet and teach them this skill, this practice of thinking about the ecosystem, just scanning the ecosystem. It's much more involved. We take them through several exercises and steps where we think about campus-based incidents, not only present and future, but historical, things of historical significance. Every institution has its own unique history. It means something to the students who are navigating on that campus today. Even though it may have happened, 10, 20, 30, 40 years ago. It's important to acknowledge those incidents and know, always thinking at the center here, who are the students at the center of this particular maelstrom? Which student identities, looking across social cultural identities, race, ethnicity, sometimes social economic status. It might be national origin. It might be gender, sexual orientation, religion. But who are the students based upon these incidents or this thing that is happening, let's say in Hong Kong? Who are the students whose identities are being targeted in this space? It might be affecting their day-to-day functioning right now. And then have a way of doing that. We have to do it every single day and have a system in place for reaching out and connecting with those communities. Bring experts from the community in to provide additional supports if you need them. But it needs to be a process that students can rely upon. They can count on you that you're doing that Norton antivirus scanning for these incidents around the country. Number 5, create dedicated roles to support well-being and success of students of color. So the key here is that schools have dedicated, and they're transparent about this, that they have dedicated attention, resources, and accountability for serving the unique needs of students of color. And doing this strategically also elevates the work and communicates to students and the entire community, again, that on this campus, these issues really matter to us. We have a dedicated resource, and very important that this dedicated resource isn't tucked away, hard to find, out on the periphery, who knows who the person is, how to find them, where they're located, right? They should be elevated in the organizational structure of your system, and ideally reporting directly to your university president or provost. And then with the team of resources and staff, then that reports directly into that person. So you get it, right? Again, the elevation, we're communicating that out. So this can happen in this way, and it can also happen in a very meaningful way, structurally and architecturally. This just happened within the last year on University of Michigan's campus. Who wants to tell the rest of the group about it? An architectural, structural reorganization sent an incredible, the unveiling of this thing, message to the entire campus community about the university's commitment to diversity, equity, inclusion. I'm not talking about a specific role now. I'm talking about a space. Say it so everybody can hear it.
I tried my cultural center was moved out of the peripheral, but on our main campus,
Right.
so students can find it.
Right. Could you all hear that? What's your name? Nicole. So yeah, talking about the Charter Multicultural Center. And if you've been around long enough, where was historically Trotter House? I see people doing like, I don't know. But right? It was, where was it?
It was challenging to find. It was one of the streets on the side. It wasn't on the main campus. I would say it's like between Central and North Campus.
We're almost not on campus, right? I'm hearing hard to find, almost not on campus. I was on this campus working with students every day, all night for over 6 years. I can't tell you right now, I don't remember exactly where it was. But when I came back to this campus last April, just the week of the unveiling, tell me about the space now. Who wants to describe it? When you've already said one thing, so it's centrally located. It is on main campus. It is steps away from the University Union and from the center, the hub of campus. And what else might you say about it? People who have had the chance to, I'm sure people here work there maybe even. Yes?
It's a really beautiful space. It's open, it's got lots of different colors. The key thing I think is that the students had a voice in every aspect of the design and the construction and everything. They're there. There's a beautiful patio on the top. There's spaces for them to work together, student organizations, all multicultural organizations.
Yeah.
It's a gem, really.
So many parts of the recommendations are reflected in what was just described about this transition from what was the Trotter House on the periphery of campus. I'm going to say sort of an older property, to this transformational space. It is beautiful and so important that students were engaged in every step of designing and developing the work and the design of the Trotter Multicultural Center. And if you have a chance and haven't seen it, I would encourage you to go there and see there. It's an excellent model, just I think an exemplar of what this means. And also, students come into that space and they see themselves reflected in some really, really cool ways. And I won't say more about that. I just encourage you to go and find out what that means for yourself. It's pretty, breathtaking. Okay. How are we doing for time? Oh, we're good. Okay, recommendation number 6. Support and promote accessible, safe communication with campus administration and an effective response system. What this is really focusing on here is what is your bias reporting mechanism? What systems do you have in place? I think an excellent question to ask yourself is, on my campus, if I were on the receiving end of a microaggression, or I was a bystander or an upstander to a bias incident and wanted to report it, where would I go? How many people know immediately where they would go? Okay, so this one, we'll give it 2 years from now, when we reconvene around this set of recommendations, every hand is going to go up, right? Because this work will have been done on campus. It's so important that we are, remember we talked about elevating, communicating, evaluating. We're putting our finger on the pulse of what's happening. We're assessing where are the hot spots, where are these incidents happening, and people need to know in the community what to do when they happen and what's going to happen. And that, again, needs to be communicated in a way that's easy for people to gather that information, take those steps that they choose to, and expect a response from the university. There's new technology, you may be aware of this, that is now assessing within institutions, organizational settings, electronically allowing people to, this electronic system is connected to the bias reporting system, and it's allowing the organizational system to identify hotspots in the organization, in the workplace, whether it's a campus, a university, a hospital center, but these hotspots. So if there are multiple bias incidents happening in the college mental health program at McLean Hospital, my program is going to light up on this system. And that's so important because then we can direct our resources and take a closer look. What in the world is going on in the college mental health program? And find out what's happening, talk directly with the people navigating that system, and respond with changes, training, workshops to make sure that those hot spots dissipate. Has anybody seen that technology, or how many people are familiar with it? It's, yeah, okay. Are you using it? Are you seeing it any way that with the Healthy Minds you might integrate that? I'm so excited about the possibility of integrating that technology into opportunities for, training and workshops. Anyway, so I digress. Okay. Recommendation number 7, offer a range of supported programs and services in varied formats, culturally relevant, and also really important to engage. I think actually this is probably one of the most effective and important places to engage, partner in lockstep with students when doing this. I refer to it as trying to get the logistical W's right of whatever it is that you're hoping to do, but specifically around delivering programs and services. If you are out of step with your students, first and foremost, you are going to miss the opportunity to learn what the barriers are to accessing those services and programs. And then you can launch the most phenomenal program in the world. If students aren't going to access that program or that service, you're dead in the water. So you have to engage with students around the logistical W's. It's the what are we going to do? Where are we going to deliver? Why are we doing this? What are the needs that we're going to address? When? What time of day is going to be most effective for the students who have labs until 5 in the like this level of detail cannot be figured out without close collaboration and partnership with students. I've seen it happen so many ways where just enormous good intent and resources and expertise went into designing phenomenal services. And I can tell you we saw this also when we surveyed campuses around the country. Just some incredible programming going on. But the miss happens in the lack of connecting with students and engaging students to make sure it can be as simple as not centering the program in the place that students feel is accessible to them. An example of this, we worked with a university close to, we'll just say in the Cambridge area, and they asked us to come and consult following student unrest around these issues. We held a number of focus groups with students, undergraduates and graduate students. We came there knowing that the students wanted some sort of psychoeducational group intervention. But we held numerous focus groups with the students to let them tell us every detail about how to roll this out in a way that was going to be effective. The university was paying a lot of money to get this done. We didn't want to put forward all these resources and have no one show up. One of the key things that we learned at that time immediately, and this would be the case on many campuses, unfortunately, is that students told us, don't put it in the traditional counseling and psychology or the medical services center. We're not going there. We don't feel safe there. Here's why. We said, We're going to challenge the system and make the system change what it is that makes those places feel safe so that over time you can access those services as you should be able to in the medical center or in counseling and psychological service. Like, that is going to be addressed. But in the meantime, tell us, where should we offer this group? And they told us. They said, put it in this case it was in, there's, a relatively remote space, it's going to be pretty confidential, and it's in the Black Student Alliance. We were concerned that other students of color might not feel as welcomed in that space, but it turned out to be, the response was just overwhelming. It really took hold for the graduate students. We could talk all day about why that was, and it's continued. The group and the format, the structure is called Mental Health Matters. It's been written about, I published about it in a book on changing institutional values. The book was titled Psychiatry and Racism, and there's a chapter there in which the Mental Health Matters format and the structure is there if you care to visit it, or just contact me directly. But it's a really good example of, like, so much time and effort went into the design, all evidence-based, because remember, we had just done this national, we knew what some of the gaps were, so we brought the evidence directly into the planning of the programming, and if we had just offered it in the wrong space, no one would have showed up for it. That was started in 2015, and it has continued every semester since. They institutionalized the resource. It continues to this day. Summer session, spring, fall, and so forth. Okay. 8, help students learn about programs by advertising and promoting through multiple channels. This is sort of a no-brainer, right? But it's really funny to sit with planners and administrators who think about promoting things on their own, and students aren't at the table. And then students come to the table and they're like, what do you want? What do you need? They push a few buttons and it's done, right? And this is something, again, where it's so important to engage students directly, because we can lose sight of the ways that they are communicating and connecting with each other in the span of weeks. We'll still be back at Facebook and they're on to God knows what. Communicating. Bring them there, let them be your boots and forces on the ground disseminating this information. It's such an essential part of the work that sometimes gets overlooked. And then wrapping up, identify and utilize culturally relevant and promising programs and practices, and collect data on effectiveness. So important. This is one of the huge takeaways, and if you know this literature and this is sounding vaguely familiar to you, like I've heard this before, you would be right. And when we reviewed the literature, we found an amazing comprehensive literature review that had this exact recommendation in it. And when do you think it was published? We don't have time, I'll just say over a decade ago. Can I just say that a decade from now, we don't want to reconvene and be in this same space with this disconnect. There is some incredible programming going on. We simply need to find out, are these interventions working? Are they moving the dial in the ways that we need to move them to elevate the mental health and well-being of students of color? Or in fact, impacting other outcomes like academic success, retention, life after college, quality of life while in college, and so forth. We have to get better at assessing it. It doesn't always have to be a scientifically robust and rigorous, controlled, randomly designed control, randomly assigned control. It can be as simple as a pre and post analysis. What did you learn? What was the quality of this? Did it address your needs, and so forth? But we simply need to add to our database here. And then finally, so important. I said this at the outset, but this is, I think you're going to hear this as a recurring theme throughout the conference today. We need to get better at sharing our expertise, the lessons learned, through often difficult challenges, barriers that we've encountered but overcome. We need to figure out how to communicate those lessons to the next school in college within your university system, right? So that when they start this process, they don't have to start start at square one. They can build upon what you have already contributed. There's a lot of excitement and energy nationally. I've been in several meetings, national meetings recently with college presidents and other leaders where people are really getting excited about this idea of creating a national repository. And I would not be at all surprised if the Seed Fund, in partnership with the other offices here at the University of Michigan, really takes the lead on that. But can you imagine that? So you develop, or I develop Mental Health Matters, and I've got the survey data, I've got the design, the structure, what worked, what didn't work, where we fell short, what our students told us, and I put it in that repository. So when someone else comes, they don't have to start, they can build upon it and maybe do a higher level of effectiveness study of that same resource. We simply have to strengthen our community of communicating this and sharing our knowledge both within in a decentralized place like the University of Michigan is absolutely critical. So within the university, but also with other colleges and universities nationally. So I'm just going to wrap up very quickly, but just 1 minute to say this, that this work has progressed. The framework was launched. There are 19 colleges and universities. These are the schools that are going through the pilot phase of this work. It includes a whole in-depth self-study process in partnership with the Healthy Minds folks and taking the diversity, equity, and inclusion module. It, again, is this iterative process, and we're going to learn so much from these initial schools engaging in this process. And that information, in a very intentional way, is going to be documented and recorded, written up. Hopefully it'll make it out into the literature, but it'll certainly be disseminated and made available to you on the website. So you can go there and you can find out, what did these schools do? How is it working there? What strategies can I learn from that they implemented? That's the second phase, and related to that, there is a lot of, they've already done the next phase where schools are beginning to identify among the 10 recommendations, what are their top 3 or 5 recommendations that they're going to really lean into. They're going to invest in moving the dial along these recommendations, and in partnership with the Seed Fund, they're going to get ongoing, on-the-ground support, technical assistance, virtual assistance, so just a phone call or a click computer away, but also visits to campus, workshops, webinars, keeping this community together, providing support, direction, guidance, and strategy for implementing these recommendations effectively. Did I get that right, teacher? Okay. And then eventually, as I said, it's going to be reported out. It's not going to be a secret. No one's going to hide this information, so you can't figure out where to find it. It is going to be sent out, so you'll be able to easily access and build upon this work that our colleagues are doing around the country. I just want to close with this quote. Oh, I thought I was going to go. Just a review of the Seed Fund. You can go to the website. These are just a quick overview of the many programs and services. Many of that information is also in this, but for not only students and campus community providers, staff, and faculty, but for parents, there's a real focused attention on reaching out to the parents of students of color who may benefit from additional support in psychoeducation, particularly destigmatizing seeking mental health treatment. Here's the quote. I just want to end with this quote. It's one of my favorite things that Kenneth Hardy says, and I'll just read it quickly and we'll close. He wrote, he was talking specifically about the therapeutic relationship, cross-racial therapeutic relationship, and he's a psychologist. He said, I also think that in situations like that, when it's cross-racial therapy, it's really important to me to name race very early in the process, which I often do. I've written about the importance of the therapist being the broker of permission. Love that term. I use myself to do that. I will make reference to myself in therapy. Well, as an African American or as a Black therapist, which is my way of saying to you, the white client or student of another race, I'm okay acknowledging race. I'm even okay if we talk about it. And I just want to close and encourage you, leave you with some words of hope and encouragement, remind you that wherever you sit in your whatever role that you're in your college, university, campus, as faculty, as staff, as providers, as researchers, we, people in this room, we may very well need to be the brokers of permission. It may, in fact, be incumbent to go back to your spaces and think about how you can be the broker of permission in advancing this work and making it okay to elevate the issue of race, ethnicity, identity, and inclusion in your spaces. Especially since we know that these issues elevate psychological risks for the students with whom we are so privileged to work. Thank you.